good necessary. So now, if we look at the functions of the normal fat, it acts as insulator of heat, as well as it keeps body moisturized or moistened, and it absorbs the shocks. So it protects and nourishes the bones, and it stores the energy so that in crucial conditions, energy can be supplied to the body. Now, all of us are always attracted to lean body shape. But the last line in this slide says that fat sometimes can be fit also. Every time pencil thins can be the fitter or healthier than a little, not, I will not say overweight, but a person who is having prakruta meda can be fit also. So rather than discussing about weight management and everything, we will think that how can we have a fit fat that is prakruta meda, and so we can have lean and athletic body weight. So more muscle mass and more bone density can be achieved while there will be no fat as well. So when we go to concept of prakruta meda, which is mentioned in our Ayurveda, so whenever meda dhatu is prakrut, what are the benefits that a person can get? So these are mentioned in this particular slide. And the last thing is important, that is concept about the Sanhata Sharir. What is Sanhata Sharir? Whenever a person is having compact body, then we can say that that particular person is having Sanhata Sharir, and this Sanhata Sharir is essential for healthy dhatu, or healthy dhatus will lead to ultimate health as well as diseases because of Shithila dhatu, which can be Staulya, Medorog, Prameha, and other diseases will not be encountered. So we need to have a body which is having Prakruta or Sara Meda dhatu, as well as all dhatus are compact or Sanhata, and there is no excess Meda dhatu or abnormal and Shithila Meda dhatu. Now, how we can achieve it and what actually doesn't allow us to have it? So the causes of obesity and its management we will see now. Whenever we think about pathogenesis of Medoroga, most important thing is that some people tend to lose weight with various measures they take for the weight management, and some people do not lose weight however or whatever they may do. So this is because two types of fat accumulation in our body, and first type is called as hyperplastic. So in hyperplastic obesity, what happens is fat cells increase in number, whereas in second type, that is hypertrophic obesity, fat cells enlarge in size but number remains same. Now what happens is whenever there is hypertrophic obesity, that is cells have increased in size, those cells can get shrunken and person can lose body weight as well as inches loss will be seen. But whenever there is hyperplastic obesity, that is number of fat cells have increased, it is very difficult, or rather sometimes it will be asadhya medorog, wherein patient cannot lose a body weight. Now when we go through the causes of obesity, we know that genetic causes, or in Ayurveda it is termed as bija swabhava. That is, in such persons, irrespective of diet, the person is obese due to his genetic setup or genetic makeup and natural selection for higher BMI, that is body mass index. Next is race. Next is lifestyle and behavior. Now, most important factor which is causing obesity nowadays in childhood as well as in adulthood is stress. And why stress will induce obesity? Because it leads to secretion of cortisol in our body, and that lowers the metabolic rates and it prevents fat burning, as cortisol is an anabolic steroid. And so it helps for conversion of food to fat, and so anxiety or anger associated with stress will definitely lead to obesity. lead to weight gain or obesity. Now, initially, endocrinal diseases like hypothyroidism, Cushing syndrome, polycystic ovarian syndrome, and also insulinoma, all these diseases are basically and directly related with the drugs. And another two important things are, first is pregnancy as later age. Why it is important? Hello, am I audible properly? Hello.
Yes, madam, you are audible.
Okay, fine. Thank you. Now, at why pregnancy at later important, because nowadays, in fact, women also would love to enjoy their career, establish themselves socially as well as in their job, and then they plan pregnancy. But what happens is, whenever pregnancy is achieved at late, because of that, even female will have chances that she will remain or maintain that weight which she has put on in pregnancy after delivery as well. That is first thing. And second thing is that a female who is having planning pregnancy at late age, her kids may have or kids have more susceptibility to obesity, childhood obesity as well as adulthood obesity. So now, what is the relation or what is basic our concern about obesity and Indians? Indians generally have shorter height and lower BMI, but they have higher body fat concentration. Now, waist circumference is low, but chest and abdominal fat is high. All of us know that abdominal fat in higher saturation or deposition will lead to multiple systemic disorders and complications of abdominal obesity. So cardiac disorders, diabetes and other complications, metabolic diseases are there. And for that, see, obesity can be a syndrome or obesity can be a cause for multiple metabolic and other lifestyle disorders. That's why there is need for obesity management. Now, when we are thinking about obesity and obesity management, when we think about the pathogenesis, we need to have basic concepts clear in our mind. That is Prakriti, Agni, Ama, and Asamhata Meda. Because treatment which we will plan for obesity will depend on these four factors. And whenever we are thinking about management, obviously management will include Shodhan, Shaman, Langhan, Dhatu Tarpan, Rasayan, as well as Lekhan. Now we will discuss what is difference between Tarpan and Lekhan, and can they be done at same time, or we have to do them step by step. Now this is the pathogenesis, but I will not go in detail of pathogenesis as the topic is Ayurvedic management. So these are symptoms, and why these symptoms arise, all of us know, and it is well mentioned in the commentary of the text, that Ayusho Rasaha. Why Ayusho Ras will be there? Because as we know that if obesity is getting n number of diseases along with it, then ultimately the lifespan of a person will be less. Javoparodhaha. Javoparod and Krichra Vyavayata, all of us know that person will achieve geriatric changes early compared to a fit person. And these are very important things. While dealing with or while discussing the management, we will deal with these things. As it is mentioned here, Sthaulya Upadrava or complications. First and foremost important is Prameha. Prameha, Shlipada, Udara, Urustambha, Bhagandara, Asha, and n number of things are there which come as Upadrava. Most important Upadrava is multiple cancers which patient will be prone to if a person is obese. Now, when we opt for lifestyle modification, we are slowly approaching towards the management directly. So when we think about the managing obesity, first important thing is that we discussed about Prakruta Meda. We should be having clear concept of Swastha. Then we should be continuously watching Trayopastambha, that is Ahar, Nidra and Brahmacharya. our dinacharya should be managed and maintained properly. Why am I stressing upon these points? Because obesity management sometimes can be a lifetime commitment. And for that particular thing, one needs to follow the regimen properly, continuously, and for longer duration, maybe for years or sometimes lifelong. Seasonal regimens, Rasayan Sevan, Achar Rasayan, these are also equally important. Now, when we think about management by Ayurveda way, two highlighted points are seen in this particular slide, and those are pertaining to most important concept in Ayurveda, and that is Ayurveda will have patient-specific approach. So it can't be this way that suppose we are planning for Shodhan Chikitsa, woman can be given to all patients who are having obesity, or Lekhan Basti can be given, or Lekhan Basti of particular combination can be given for patient. That won't stand true for from Ayurvedic perspective, and so we need to have patient specific approach, and that patient specific approach is also multifold that we will discuss later. Again, another important point is realistic look at your body type. Whenever we are thinking that realistic view at our body type, so it pertains to the way I said, whether body is Shithila Dhatvatmak or Samhata Dhatvatmak, whether body constitution is Vata Pradhan, Pitta Pradhan or Kapha Pradhan, and in which age group particular person, patient is falling. So let's discuss about it. Apart from these things, if there is any Am and Kleda Sanchiti, generally Am concept pertains to Jatharagni Mandya, and in case of specifically Staulya and Meda Dhatu, Kleda is the concept wherever Meda Dhatuvagni Mandya is there. So in where though I have mentioned that elimination of Ama, but while managing obesity, we need to think about the management of Dhatuvagni also, that is Dhatuvagni Mandya also should be treated, and Jatragni Mandya obviously needs to be treated. So these two things are to be remembered. Now next is most important slide I would be saying. When we are thinking that obesity management is to be done for say months together, years together, or it needs to be managed for a lifelong commitment, we always, as an Ayurvedic physician, it is our responsibility that we should consciously and cautiously watch that while giving Kapha Medogna regimens, we are not increasing Vata in patient's body. Why am I saying so? Suppose any person wishes to lose weight, and for that we are giving say Gugur or other Lekhana Dravya or Chedana Chikitsa and Kapha Medogna Dravya. But if it is evident in some days or later that if person is having Vata Vruddhi Lakshana, that means Langhana, Chedana, Lekhana, Rukshana, all these chikitsa of Medorog or Staulya are increasing Vata. I will give you an example that whenever we are giving Ruksha Udvartana, Swedana and Lekhan Basti to a patient, say for a regimen is advised for 10 days or 20 days, and on 12th or 13th day, if patient says that there is body itching and skin dryness, what it indicates that there is exaggerated or extra loss of Ardra Guna and Snigdha Guna, and which is causing Rukshatva now. What we want to achieve is normalcy. It doesn't mean that by decreasing Snigdha Guna, we need to increase Ruksha Guna. I hope all of you are understanding it. And so continuous watch should be there that by decreasing Kapha and Meda, there shouldn't be increase in Vata. Otherwise, this particular vitiated vata will be again barrier in weight loss, and it will lead to dhatukshaya and daurbalya along with obesity. So conscious effort should be made for this particular thing. Now, other factors which we need to take into consideration while managing Sthaulya are vaya, that is, whether we are treating childhood obesity or obesity during puberty and adulthood or pediatric obesity. Why it needs to be thought is all these three age groups will have particular dosha, prabalya or dosha as per their age. And this particular thing will be in balyavastha, there will be always kapha pradhanya. So tendency or naturally nourishment should be given, and in such conditions or in such stages, if we try to scrape body too much by Langhan and Rukshan, then that can cause dhatu nasha sometimes if treatments are exaggerated, and will lead to daurbalya lifelong, which we really don't want. In adulthood also, as it's a fertile age group, what we need to understand is whenever we are giving kafagna chikitsa or medogna chikitsa, we are generally decreasing ardra and snigdha guna in body. Obviously, we are trying to decrease these abnormal characters in the body, but these ardra and snigdha guna are there in rasa dhatu as well as shukra dhatu. So, in fertile age group, if we give excess lekhan and chedan or Meda and Kafagna Chikitsa, it should not lead to Shukragna action of the drug, as it is encountered sometimes excessive use of Vidanga, which is also a Lekhana Dravya, can lead to Shukra Nasha or Bija Nasha. So all such things should be taken into consideration. Whereas suppose we are treating obesity in senile age group or geriatric age group, and we are giving excessive lekhan chikitsa or medogna chikitsa, sometimes chances are there that there can be excess lekhan leading to vata prakop, because that is natural age of vata dominance. So obesity management should be decided, or the treatment protocol should be decided, whether you are treating a patient in childhood age or in fertile age or in geriatric age group. Same way, consideration of Prakriti is also equally important, because if we are giving Langhana Chikitsa for Sthaulya in a person who is basically having Vata dominance in his constitution, then Langhan should be monitored and there shouldn't be excess Langhan, as that can cause Vata Prakop. Whenever we are treating Sthaulya in Pitta constitution patient, it is equally important that Lekhana Chikitsa, especially with drugs like Yavakshar, Chitraka, Trikatu, Panchakol, or basically Katu Rasa Pradhana Dravya, should be used cautiously, as they can vitiate Prakrutistha Pitta of a person who is having Pitta dominating constitution. Whereas treating kapha constitution Sthaulya patient is comparatively easier, but only thing is that a person who is having kapha dominance in constitution may be a sukumara patient. Generally, we feel that kapha dominant patient will be very strong and stout, so we can give excessive langhan or tivra shodhan. But only cautious efforts should be to rule out whether patient is having sukumaratva. Then patient won't tolerate tikshana shodhana chikitsa, and we have to shift patient from shodhana regimen to shamana regimen. It may look little boring or theoretical, but whenever we treat patient, we encounter all such complications as well as problems in patient, because obesity management cannot happen overnight or fortnight. You have to be with the patient consistently and continuously. So sometimes patient can require continuous shodhana chikitsa, nitya shodhana or periodic shodhana, and so all such things should be taken into consideration. Another important aspect while designing treatment protocol should be whether obesity patient wants to lose weight as a kamya chikitsa or for a specific what we can say specific achievement. It can be, say, PCOD is there in a patient who is in pubertal age, and so weight loss is indicated for irregular menses or oligomenorrhea and other problems. In some fertile age patients, if they are having infertility, then also weight loss is indicated, and others may require it for cosmetic purpose also. Whenever patients come to us for this particular specific requirement or need and they want to lose weight, what we always should advise patient that being healthy and being fit is a lifelong commitment. So let them achieve whatever their instant need is. But a person who wants to have good weight should remain healthy as well. So it can't be this way that now I'm getting treated for my primary infertility, and once I achieve fertility and have baby, then I can ignore two things. If that particular tendency of weight gain is there, it may cause other problems. So right now someone is wanting treatment for staulia for primary infertility, maybe later on will require it for dyslipidemia, maybe later on require it for osteoarthritis of knee joint because of truncal obesity. So if a person is obese, that person should follow particular regimen for uh, lifelong commitment to remain healthy and not only for weight loss. Now, when we are giving treatment, my basic concern and my expertise basically is in female obesity, and I feel that female obesity has a different perspective when we treat the patient. Why? Because females go through different stages of life, and as per the stage of life, treatment and management will definitely change. And so we need to be very, very focused while treating female obesity in different stages which are particular. If it's a childhood obesity, maybe male and female child not have very much difference in the regime. But once a girl attains puberty or in a pre-pubertal stage, we need to cautiously give the treatment so that there shouldn't be artavanash. See, artavanash be because of two things. One, because of obesity and there is margavarod, and another because of vata prakop and artavanash. So we need to understand that which sort of treatment is essential for the particular girl, and treatment plans should differ in pre-pubertal stage, during menarche, for fertile female, for postpartum stage also. Many females would like to regain their shape, body shape and body measurements which were there before pregnancy. So at such a stage also treatment should be different. So postpartum stage also, one should not give medicines which are causing rasa and kapha chikitsa, because that can compromise with the lactation of the mother. So in postpartum stage, treatment plan should be different. In fertile female, treatment plan should be different. In perimenopausal and postmenopausal stage also, one should always think about natural vata dominance and give the treatment. So excessive shodhan shouldn't be given. Rather than that, and obviously I would always say that if person is obese, truncal obesity or buffalo obesity or cylindrical obesity, then try to have udgharshan only at the obese parts. Don't give full body udvartan or udgharshan to a female who is in her perimenopausal or postmenopausal menopausal stage. So such smaller alterations will also give better results and will definitely save patient from the complications and effects of treatment which are not given properly because of non-consideration of the particular stage and stage-wise requirement. So PCOD and menstrual abnormalities and infertility. So especially females need to be treated with lot of precautions and specific approach as per the age stage as well as the requirement of that particular person. Now coming to the childhood obesity, the picture itself is reflecting the man is measuring the height of the child as well as the woman is measuring the horizontal increase in size of the baby. So childhood obesity, we need to think about, see, most important thing about childhood obesity is whatever complications of obesity are there, that particular child will have to bear them for a too long time. Suppose any person gains weight or obesity, say at the age of 30, chances are there that he or she has to carry that weight burden for 40 years. But just assume about a child who has got childhood obesity as at the age of 6 or 7 years will have to carry that burden of obesity for say 65 years, and so more and more complications and more difficulty in treating that obesity will be there. So if you feel that child is having tendency towards childhood obesity, immediately intervene, and while allowing his dhatu to develop and dhatu portion should be continued. So nutrition of dhatu as body constituents should be continued. Only we should think about cutting on fat, rather modifying loose fat or shithila medodhatu into compact or samhata medodhatu. So conversion of shithila medodhatu to samhata medodhatu is what should be indicated. Why again I am stressing all these things? Because medication is highly contraindicated in childhood obesity patients, and so diet and exercise regimen should be given, and udvartan, udgharshan and swedan, not in peti swed or bashpa swed, but swedan by hot water bath can be advised to a child, so that we are not compromising his dhatu from getting nourished, but we are only converting abnormal fat to normal fat. So risks of childhood obesity are morbid structural changes can be there. Child may face pubertal issues as well as fertility issues later on. Risk of DM, that is diabetes mellitus, and cardiac diseases is very high. Ayusho Rasaha, that is longevity and less lifespan will be there. Span of obesity burden is too long, and early age metabolic and hormonal changes will be there. So childhood obesity is a risky affair, and we should screen children for obesity and try to manage them as early as possible. Now, if we think hormonal collaboration and obesity, the first point itself tells us that excess adiposity in girls and delay puberty in boys. So a child who is entering from his childhood age to pubertal age will get compromised at the first point itself. Apart from that, the girls who are having childhood obesity tend to have adolescent PCOD, that is, or PCOS, that is polycystic ovarian syndrome. GnRH, that is gonadotropin releasing hormone and luteinizing hormone will be compromised, and so there will be multiple changes in body which will be permanent as well. So again, insulin resistance will be developed at puberty, and it may exaggerate again obesity later on as well. Most important thing, the last point states that obesity is often associated with inflammatory changes and marked changes of cytokines and adipokines. So these can be termed as a sort of toxic material which will be created in body, and these inflammatory markers will definitely body prone for cancerous conditions or autoimmune disorders, as well as hormonal diseases or endocrinal disorders. So if we wish to prevent, how can that be prevented? Prevention of childhood obesity can be done by Bija Shuddhi, that is Shodhana Chikitsa and Bija Shodhana Aushadhi prior to conception should be taken by both the parents. Why it is essential? Because we have seen first an important causing factor or causative factor of obesity, and that was Bija Swabhava. Genetic or hereditary obesity can be what we can say curtailed or decreased generation by generation, and eventually after multiple generations we will be able to have complete bija shuddhi. So this concept of bija shuddhi is essential, and shodhana as well as bija shuddhi chikitsa should be given to parents. Then comes the garbha sanskar. Garbha sanskar are basically for fetus. Generally, we tend to have Garbha sanskar basically for intellectual and psychological growth of the baby or fetus. But basically, Garbha or fetus is infantile origin of adult diseases. So, in Garbha sanskar, if we can uh, have monitor the garbhini properly, not stuffing her with lot of calorie rich food, but giving her healthy diet, then also childhood obesity can be prevented. During balyavastha, so encouraging or promoting breastfeeding and trying to cut down the formula feeds will also be act as a bala rasayan in a baby. And our ancient treatment, that is guti treatment, which is given to, or balaguti, which is given to infants and newborns, will also help for curtailing or preventing the childhood obesity. Suvarna Prashan also can help for having Samhata Dhatu, and for that Suvarna Prashan can help. So preventing childhood obesity can be done otherwise also, or additionally, by promoting healthy eating and outdoor physical activity in children. Please try to understand, all of us need to understand that physical activity and exercise cannot replace anything, because one cannot have dietary restrictions lifelong, because then there will be anger and agitation, anxiety and depression as well because of the dietary restrictions. But if one starts enjoying physical activity and exercise, then it will be a boon, because it will not only give your fit body but fit mind as well as energy to work also. Now, treatment plan in general about obesity can be divided into multiple things. First, the way Ayurveda says that Nidana Parivarjan, if we have found out the cause. Now, Bija Swabhavat or genetic or hereditary obesity will be primary obesity, and secondary obesity will be because of some other cause. So, if we have found out that particular cause, then nullifying the cause will be the treatment, that is Nidanasya Parivarjana. Then second treatment will be Satata Karshana Chikitsa. Though I have mentioned Karshana here, but rather than Karan, it has to be Medogna and Kafagna Chikitsa. So it can be continuous or it can be repeated, means you are giving treatment, then taking gap or of some days, or and then doing it again. Sometimes it can be treatment also. By periodic treatment, what I mean is, suppose a female is having obesity and PCOD, then periodic treatment like Lekhana Basti from 5th day of menses, or Yoga Basti Chikitsa from 5th day of menses for 7 days. And this is what is I mean as periodic treatment. Again, periodic treatment, not only Shodhan, but Shodhan and Shaman, both will be required for people who want to maintain their body after reduction of. So it is not only weight reduction, but it is maintenance of the reduced weight as well. So this particular treatment should be given repeatedly or periodically as per the requirement. Then next is Guru Apatarpan or Guru Atarpan diet or dietary regulation. All of us know, that's why I haven't mentioned any book or details of that Gurucha Atarpanam Nayam Sthulanam Karshanam Prati. That is what our text says. So what it means, that diet should be heavy for digestion if patient is good appetite, that is Jatharagni Sandhukshan is well achieved, and that particular diet should be low in calories or low in poshana, as in it should not give energy for storage, but it should give energy for instant expenditure. That is the difference between Tarpana and Bruhana. Tarpana will give instant energy which you can utilize, but it will not be stored in body, whereas Bruhan will give the energy which can be stored and later on it can be utilized. So diet regulation should be always indicated as per Jatharagni. If Jatharagni is good, Guru and Atarpan diet should be given. If Jatharagni is not good, then Laghvashan Roop Langhan can be given. Next point is Langhana Chikitsa. Langhan can be both ways, Shodhana or Shaman and Pathya. As respected Sabni sir will be talking about diet, I won't go in details of Pathya and diet. Whenever we are designing a treatment protocol, we can design it as per the BMI of the patient, which treatment should be given to that particular group of patients. This is a general statement. That's why, though I have mentioned detail, the next to that table, one line is mentioned, and that is BMI is not the only criteria. Whenever we are dealing with Ayurvedic management, BMI should not be the only criteria for planning the treatment. The way we have earlier discussed, constitution of the patient as well as the dosha which is vitiated and Dhatuvagni Mande should be treated. So apart from these things, what is required? Karma should be given. Suppose BMI is high, then the way we always decide or discuss about the dosha dominance. If dosha are very high in strength, then primarily Panchakarma or Shodhana Chikitsa can be given, and then Shamana can be planned. If dosha are minimal, then Shodhan and Shaman can be planned at simultaneously. If are vitiated only little, then Shaman Chikitsa can be sufficient to the patient. Inshallah Chikitsa, why Panchakarma should be given? Because in Sampati of Medo Rog or Sthaulya, it is mentioned that this particular kapha, rasa, and Meda, all of them will block the channels, that is Sroto Rodha. So Panchakarma is required for Sroto Shodhan also. Unless and until Srotas Shodhan is achieved properly, nutrients cannot reach each and every dhatu, or else there will be only or portion of Medo dhatu, leading to more and more fat saturation. So Panchakarma is indicated for removing body toxins as well as for Sroto Shodhan, and after this particular two things, simultaneous Kapha and Medagna activity will be achieved, and Jataragni as well as Dhatuvagni will also be potentiated. So Panchakarma is very important. There is one reference in our text wherein it is mentioned that woman should not be given to Staulya patient. I sincerely feel that woman should not be given to a person who is having severe abdominal or truncal obesity. Why? Because of that laxity of abdominal muscle, woman vega will not be proper, and so there are chances of patient lying down into Asamyak woman, which will again have its own consequences. So if a person is having abdominal or truncal obesity, rather than woman, Virechan and Basti can be preferred. In some patients, woman can be given, but it should be decided. That's why it should be a patient-specific treatment, not a generalized treatment. So while giving Panchakarma, generally all of us tend to give Lekhana Basti, right? There are other Basti also which can be given to patient. While giving Virechan also, according to me, we should always think about the Srausana, Anulomana, Rechana and Vedan as per requirement. Why Srausan is again important? Because we will be seeing the definitions of Lekhana and Chedana. Probably that's the next slide. Yes. In Lekhana and Chedana, what we achieve is, if you can see the sutra of Chedan and Lekhan also. In Lekhan also, scraping and liquefaction of dosha is achieved, and in Chedan also, it is achieved, or it is what expected, that whatsoever dosha or amalgamation, mixture of dosha and other material is there and it is stuck in the srotas, that should be removed, or that will be removed. And Lekhan are basically meant for Sukshma Srotas and Dhatu Srotas, whereas whenever we are thinking about Virechan, Chedan, Virechan, Vedan, not Lekhan, Virechan, Vedan, Srausana and Anulomana, we are dealing with Jatharagni and Koshtha Shodhan. So Virechan is required. Purisha Virechan as well as Mutra Virechan, both the things are required, because all of us know that Kleda is Mala of Meda and Mutra functions for Kleda Vahana. So whenever we are designing treatment protocol, initial treatment should be Kleda or Kleda Pachana Chikitsa followed by Mutrala Chikitsa that will allow Kleda Vahana outside, or Kleda removal from the body by Mutra Chikitsa. So Kledogna Chikitsa is initial part and Kledovahana Chikitsa will be next part. So we have discussed about woman. Virechan also should be given. Sometimes Virechan is required on daily basis, but that should be Mrudu Virechan. Generally, diet modification which will achieve Virechan should be given. And then for Basti, we will discuss in details about all these Bastis because those are important. Now we have discussed about Koshtha Shodhana by Shodhan Chikitsa or Panchakarma. And now Chedan and Lekhan should be done while we are dealing with the Srotasa Shodhana, or eradication of dosha and constituents which are there in Srotas. So Chedan and Lekhan Chikitsa are equally important. We can see the drugs and which are utilized regularly in Saulya Chikitsa, Yavakshar, Maricha, Shilajitu, Madhu, Vacha, Poshana Jala and Yava. So drugs as well as diet both are included over here, and we will see details later on. So please think about continuous Chedan and Lekhana Chikitsa for Sroto Shodhana and for relieving Marga Varod which is there in the channels, that is Srotasa. Now in Basti Chikitsa also, let us not depend only on Lekhana Basti, because as Lekhana Basti contains Gomutra, that is cow urine, and Yavakshara. This Kshara and Mutra sometimes may cause abdominal pain and burning sensation. So we should be always ready with plan B, plan C, or the alternative in Basti. And these Bastis also can be given. Those are namely Utkleshana Basti, Doshahara Basti, Shodhana Basti, and Madhutailika Basti. So ingredients are mentioned over here, and these Basti will also achieve Medo and Kafagna action as well as Sroto Shodhana. So these Basti can be given to patient to achieve weight loss as well as Medogna Chikitsa. These are two different combinations of Lekhan Basti, as Lekhan Basti is supposed to be the very beneficial treatment for patient. But what I have seen in my 20 years of practice is not only Lekhan Basti, but even Yoga Basti when given to obese patient who are having more of fluid component than fat component gives better results. And Lekhan Basti also gives good results in patient, and patients who are having stubborn fat in them will require further repeated courses of Lekhan Basti as well. So there are two combinations. One combination has decoction of multiple herbs which are mentioned in the bracket. Another combination has triphala. So whenever you are doing treatment in charitable hospital, maybe only triphala quath also can be used. Then along with that, rather than mixing til tel, sarshapa tel is mixed because sarshapa oil is said to be better for management of sthaulya. Honey, yavakshar, saindhav, and gomutra. This is the combination, but as per patient requirement, we can formulate or we can change the or alter the combination, and as per patient requirement, we can change the medicine. Now, when we come to local treatments, why local treatments are important? Because local treatment will not interfere with the body metabolism as oral drugs will interfere or impact. So in local treatments, all of us know that Udvartan, Udgharshan is the main treatment which should be done. And retrograde powder massage by rubbing, vigorous rubbing should be done. And drugs used are triphala, nimba, musta, vacha, shunthi, ash of cow dung if you utilize for udgharshan, especially for abdominal obesity, gives very good results, and it can be seen also. Then there are multiple lepa chikitsa. Lepa chikitsa is generally indicated for another important thing is that triphala tail is also mentioned. So that also can be used for basti as well as abhyantarpan as well as snehan also. In Lep Chikitsa, basically Lep which are mentioned in our text are indicated towards the Daurgandhya Nashana and Swedo Nashana action. Those are less useful for Medo Lekhana. But obviously a drug that is causing Swedana as well as Daurgandhya Nashan will have little effect on Medogna, will have little Medogna effect as well. So Swedan should be given to patient. If patient is having stubborn fat, then think of Putti Swed, Jentak Swed and other Swed which are definitely stronger if patient can tolerate and if patient is having stubborn fat. But if patient is having loose fat which needs to be removed, then Peti Swed or Bashpa Swed can be sufficient. And in patient who are having Pitta constitution, Guru Pravarana and as well as Ushna Avagaha or Ushna Koshana or Ushna hot water bath will also be sufficient. Basically prefer Anagni Swed for Pitta constitution, but for Vata and Kapha, these Swedana, Agni Swed can, Agni Swed can be utilized. Now in Shamana Chikitsa, what should be the aim? Pacifying measures should be given for basically vitiated dosha, for lekhana action, and tarpana chikitsa. Tarpana chikitsa, the way we discussed, for nourishment, daily nourishment of dhatu and body constituents should be done. Otherwise, vata vruddhi and langhana lekhana will lead to vata prakop and dhatu kshay and daurbalya. And most important thing is it will not help in weight loss, but it will only increase daurbalya or weakness. So that should not be there. So Shamana Chikitsa is basically a Punarbhava Chikitsa also. So patient can maintain on its already lost weight, and so patient can have a healthy life. So when we are thinking about drugs in Ayurvedic management of the Shaman Chikitsa of the patient, I think I will have to wind up a little because my 1 hour will end soon. So we will discuss about the main points about all these drugs. Gugud should be given as we use Gugud basically for Asthi Majjagata Vyadhi or mouse and so a person who is having any osteoarthritic changes should be Gugud, which is Nava Gugud, because that will act as Bruhana. Now how we can give Bruhana? We want to deal with osteoarthritis, and that's why processed Gugud can be utilized so to take care of osteoarthritis. But if our whole and sole intention is weight loss, then Zuna Gugul, that is old Gugul, should be given because that is having Lekhana action. So make it sure what is the indication for using Gugul and then only use Gugul. Now Shilajit is the best drug. Why? Basically because Shilajit is Lekhan also. Shilajit is boon for who are having the constitution, who cannot have Gugul for longer duration. So Shilajit should be given in Vata Pittaja Samprapti and Gugul should be given in Vataja Samprapti. Triphala, all of us know, is a very good drug. Triphala has multifold actions. Triphala Kwat can be used, Lekhanabasti. Triphala Churna along with honey can be given as Rasayan as well as Medogna action. Only Avla can be given because it is having Vayasthapan action. And we have already seen that in Medo Roga or Sthaulya, there is Ayusho Rasaha Javoparodhaha. So Avla can be utilized in multiple ways. According to me, if a person can use fresh Avla gives better results than Amalaki Churna. So try giving Amalaki separately. Though you are giving Triphala Churna, still give fresh Amla with honey to a patient for Vayasthapan action. And that will definitely improve Dhatu Samhanan as well as Dhatu Saratva. Because it is a Rasayan and Vayasthapan Rasayan, it will definitely help. If you feel that person is very obese, then in Triphala also you can increase quantity of Haritaki compared to Amalaki and Bibhitaki and use it. Another drugs which can be utilized, Nagar Mutha. Musta is a drug which should be given initially when we want to have weight loss with body water retention, means weight gain is because of water retention and we want water retention. Then Musta is the best drug. If water and fat both need to be removed, then Musta, Haridra and Vidanga combination will give better results. If Agni Mandya is there, then second drug, that is Chitrak, will be useful. If Dhatu Agni Mandya is severe, then Chitrak is useful. Chitrak will be utilized in obesity along with hypothyroidism also because it is having very good Dhatwagni Mandya action. Shunthi, as it is very useful, Shunthi, Marich and Pippali. Trikatu can be given for Vata Kafaja, especially Kapha Pradhan elements along with honey for scraping action. Devdaru is utilized. Atasi, flax seeds, nowadays everyone eats after having food for having good digestion as well as having good metabolism also. Kanchanar and Kukutnaki, these two drugs are basically indicated for localized obesity. What is localized obesity? If lipomatous formation is there or medoja granthi are there in multiple numbers, then Kanchanar and Kukutnaki will give better results rather than in using Kanchanar Gugul for basic. It is basically indicated for Granthi and Arbut. So rather than I use it for Medoja Granthi rather than utilizing it for solo Sthaulya. Tuak and Tuak Patra. All of us know that Tuak is proved to be having dyslipidemic action, sorry, antilipidemic action. So, Tuak Siddha Jala or Tuak Churna with honey is given for fat which is there in blood. That is, if lipid saturation is high in blood and lipid profile is deranged, then Tuak can be utilized. Yava is the diet, I would say, for obese patient, and yava can be utilized in n number of ways. There are some do's and don'ts while having yava ahara. Those should be instructed to the patient, and then we can use yava in ample quantity. Along with yava, all dhanya, that is we term as millets, all millets will be very useful. Obviously sir will focus on that particular point, so I won't go in details, but all millets are, or which we term generally as kshudra or kudhanya, can be utilized very well for chikitsa of sthaulya. Kukutnaki and Agnimantha. Agnimantha is a very good drug. A person or a patient who is having Amavata and Sthaulya, Agnimant would be the drug of choice. Another Shamana Aushadhi can be enlisted. There are hundreds of drugs. I have a list of all those drugs. Almost 142 combinations are mentioned in various Ayurvedic texts, and we in our institute are having research projects also. Vidangadi Churna, then Vachadigan, Haridradigan. We have already done research on it, and it has proved to be very good. But for all Ayurvedic researchers, academicians, and students, I would definitely request that once you see the combination or particular yoga or kalpa, just try to understand the pharmacokinetics of that particular combination, and then only use that particular drug, because every drug cannot be utilized everywhere. So if you understand the particular combination for the requirement of your patient, and then choose the drug accordingly, so that with lesser dosage and lesser treatment you will get better result. So Eranda and Bapula are also useful. Badar is again a useful drug. Bijaka and Atimundi, Jambu, Haridra, Patola, Shakotak. Shakotak, all of us know, is utilized for Medogna action, especially in lymphatics, that is for Shlipada. So if that sort of disease is there, which is complication of obesity, sometimes I will not say that it is lymphangitis and Shlipada. Shlipada in Ayurveda and obesity. Then Shakotak can be drug of choice. Honey is very useful, but always mention, generally people take 1 glass of water and 1 spoon of honey. That will not be useful. 1 part of honey and 4 parts of lukewarm water, that much concentration of honey will be helpful, not in cities like Mumbai or Nagpur, but in cities like Mahabaleshwar, Satara, where you get a lot of cold. So in such weathers, Desha Vichar is also important. So honey as a treatment for sthaulya can be given at such areas. And another combination can be honey and ginger mixed, and 3 grams of it can be taken early morning before food. Gomutra is another drug. Many patients drink Gomutra in the early morning. Stubborn fat, then only give Gomutra. No pitta vitiation, then only give Gomutra, not otherwise. There are different group of drugs mentioned in Sushrut Sutrasthan, and all these groups have their specific indication for Medogna action. Generally for Basti and Ukleshan Basti also, Ushakadigan is mentioned, Salsaradigan is mentioned. Drugs in this particular Gana, here Khadata Chandana, Shirisha, Asana, Arjun and Agaru. All these drugs are available. So these drugs are given as Niruha Basti, path of these drugs, and it is very useful in case of Sthaulya Chikitsa. All these, Valli Panchamu, Kantak Panchamu, we are well aware and can be given for Basti Chikitsa as well as oral treatment also. There are other drugs as well, so those also can be utilized. Now, there was specific mention about the abdominal obesity. For abdominal obesity, Lauha Rasayan, Lohasav and Loharishta are best preferred drugs. Obesity many a times is associated with anemia as well as rasakshaya, because patient try to have different diets on their own, and then they lie down into rasakshaya and shabda sahishnuta and all such complications, but weight does not reduce. But for weight loss as well as for replenishment of all such nutrients, Lauha Rasayan can be given. Varunadi Kwak is very good drug for abdominal obesity. Chitrak, Kutki and Trikatu is a very good combination for abdominal obesity. We are using it in our OPD of our hospital. These are various combinations, but generally all Ayurvedic physicians, the way well-known Ayurvedic physicians say that don't go for the combinations. First, see what is pathophysiology constitution of your patient, and then go on searching the drugs for the patient. So all these drugs can be utilized in patient for management of obesity. The way we just discussed, Vidangadi Loha. Suppose patient is having good dhatu, then give Vidangadi Vataka. If patient is having anemia and obesity, give Vidangadi Loha. Other drugs are also mentioned, but because of lack of time, I won't go in details of each and every combination. Whenever patient is having fatty liver and obesity, obviously a drug like Arogyavardhini can be given in combination with Triphala, Madhudak and other drugs. So these are various Churna, Gugul Kalpana, Kuath, Agnimanta, Triphala, Patradi Kashay, Shirishadi, Shaileyadi, Udvartan and other drugs. These are shaman drugs, especially Taila. I have also already mentioned about Triphala Taila. Lay are also mentioned. So these are the references. You can go through the references, search the drugs and use them with your discretion. About Vyayam, only 5 minutes I will take. Vyayam should be advised as a lifestyle modification and not for 1 month, 2 months or 6 months. And Vyayam protocol should be given to the patient as per the constitution and body, not only body constitution, but the sahatva of the patient. And that can be decided. Yes, here in this particular slide, it is mentioned that yoga, basic sun salutation, Surya Namaskar, in spite of Prakriti, Sukumaratva or anything, every patient can do. There are n number of YouTube videos also for patients who cannot bend down, and also modified Surya Namaskar position by sitting in chair is also given. So all such modifications, when there is will, there will be a way. So a person or a physician who wants to give treatment to a person who is willing to reduce weight should advise all such things, but kindly accept the particular thing that it's a combo offer of Pathyakar Ahar, Uchita Vyayam as well as Aushadhi. Then only person can achieve desired weight loss, not otherwise. In different yogic postures or asana are also useful. Pranayam, especially Kapalbhati, Bhasrika and Sinha Mudra, which are intended towards increasing metabolic rate, are useful. Nadi Shuddhi Pranayam, Surya Bhedan and Shankha Prakshalan, if done with proper yogic guidance, will give very good results. Nowadays, there is colon hydrotherapy. Okay, newer thing has come up for obesity. So if Shankha Prakshalan and all such things are done with proper yogic observance, then you will not require colon hydrotherapy and other sophisticated treatments. Then exercise as per the constitution for Kapha Prakriti, Pitta Prakriti and Vata Prakriti. Set of exercises or type of exercises are enlisted over here, which can be advised to the patient. Now, there is one concept of Ajirana Manjari. Many a times what happens is a person who lives in Konkan and wants to reduce weight, if we tell him to cut on rice, then that is difficult or that is not possible. So a person who is basically not addicted but loves to have these things which will induce obesity or which will tend to which because of which patient will tend to put on weight, then sort of antidote is mentioned in our Samhitas, that is Ajirana Manjari. Generally, it is mentioned for a person who is having it in excess. But I am telling it here that who is having it in regular diet. So these patients, if can have these antidotes, will help them. It doesn't mean that keep on eating maida and then have cucumber, that will help you. That is not the case. But if you are having them, try to reduce them, and once in a while if you are having them in excess quantity, try to have the antidote. That will be useful. Behavior therapy means that there should be continuous effort for weight loss and weight management. It's not a task for limited period, because weight loss and weight management, you will lead to a healthy and swastha ayu, and that is the motto of our Ayushya. So goal is weight maintenance and prevention of weight gain. So treatment is given for weight loss, then weight maintenance and prevention of weight gain. So threefold treatment will be essential. These are the references which you people can go through to go in details of the management of sthaulya or obesity. Thank you, Dr. Daga sir and organizers for giving me this opportunity to share my views about the management of obesity by Ayurveda. Thank you so much. Thanks for your patient listening as well. Thank you.
Thank you very much, madam. Thank you for your valuable and very informative session about obesity and its Ayurveda management. Thank you so much. Now, I will request our MUHS observer, Dr. Meenakshi Amrutkar, madam, if she want to give some remark. Please, madam.
First of all, I am very much thankful to Maharashtra University of Health Sciences for giving the opportunity as a university observer in this webinar. Speakers of this webinar are Dr. Mukund Sabnik sir and Dr. Anaya Pathikar ma'am. I know personally both of them. They both are clinically sound, especially in obesity. What to say about Sabnik sir? Sabnik sir has huge work on obesity and having huge data too. I personally heard sir's lecture many times, but today we can't heard sir's view regarding obesity because of some technical problem and surprise visit of NCISM of college. Otherwise, overall webinar is good. Lastly, I want to say thank you and congratulate to Dr. Danga sir and his organizer team, especially Dr. Seema. Thank you.
Thank you, madam. Now, I want to thank to Dr. Mukund Sabnis sir as the first speaker of this session, and Anaya Patrikar madam especially. See, both of them have spent their valuable time and put many inputs in the webinar. So thank you so much, madam. Again, I want to thank our principal sir, our management, for giving permission for this webinar. I want to thank MUHS for giving permission for endorsement. So I want to means I'm sorry that there was some disturbances because of surprise NCISM inspection. So thank you. YouTube link and video will be shared in the group. So don't worry. Zoom recording is there with us. And previously in April of month, we have conducted one webinar. Dr. Mukund Sabnis sir. So that lecture is also we have in Zoom recording. We will share all the recordings to you in the group. Don't worry. So I declare that the webinar is over now. Thank you to the speakers, attendees, and faculties and students. Thank you so much.